Hello, I'm Dr. Sharayu Bhagat, consultant in Bhagat, Oasis Bhagat. So, my topic I'll be discussing today is fertility treatment in PCOS and what precautions should the person take. So, coming to PCOS, it is a complex hormonal condition that impacts around 5 to 10% of women of reproductive age. It also disrupts the normal balance of hormone, which ultimately leads to elevation of androgen levels. These are also called as male hormone, and it leads to insulin resistance. So, due to this, women with PCOS, there is irregular menses, difficulty in ovulation, which ultimately makes the conception more challenging to a woman. So, for PCOS, there are fertility treatment, and with right support and strategy, women with PCOS can achieve successful pregnancy. So, we'll be discussing the treatment. First is lifestyle modification. So, before any medication and any surgical management, the cornerstone of management PCOS and improvement fertility lies in the lifestyle modifications. First is modification. PCOS women often are seen to struggle with weight gain due to insulin resistance. So, weight loss of 5 to 10% can improve insulin resistance and insulin sensitivity, which helps to regulate the menstrual cycle and restore ovulation. Dietary changes, rich diet with whole grains, proteins, fruits, and fresh vegetables can be included in the diet, and minimizing the processed foods and refined sugars, which supports balance and balanced insulin levels. Foods with low glycemic index like green leafy vegetables, nuts, whole grains, which prevent spikes in the blood sugar levels, can be advised to women with PCOS. Regular exercise is also recommended. Physical exercise with weight management also improves the mood and it decreases the insulin resistance. So, a person can do activities like walking, swimming, strength training, which ultimately leads to hormone balancing. Coming to the medical part, medications to stimulate ovulation. These are considered when lifestyle changes are not enough. So first drug we give is clomiphene citrate. It is the first medical management for ovulation in PCOS. It is a selective estrogen receptor modulator. It blocks estrogen receptors in brain and it increases the FSH, which leads to the stimulation of ovaries. So clomiphene citrate may not work in all, and it also causes multiple pregnancy. So we consider the second drug called as letrozole. So letrozole is preferred over clomiphene in patients with PCOS due to increased success rate, and it is an aromatase inhibitor which decreases the estrogen level. Also, in PCOS, metformin can be given. It is used in patients without any diabetes or without any high sugars. So, it is generally given to improve the insulin resistance and it restores the ovulation. And it is often used with clomiphene citrate and other fertility medications. Coming to the advanced fertility treatment, when simple methods and medical management is not enough, we come to the advanced method. So in advanced, coming to first is IUI. It is less invasive method compared to others. It can be tried when duration of fertility is short and there is no major male factor involved. So it is done with clomiphene or letrozole, and we stimulate the ovaries with the drugs, and we monitor. And once the ovulation occurs, we can do the IUI, and along with the clomiphene citrate or letrozole, we can continue the patient on metformin. If IUI is not sufficient, then we come to IVF. It is recommended in patients with more duration of infertility and when other treatments have failed. It has comparatively increased success rate compared to IUI, but also it requires careful monitoring to avoid OHSS, which is ovarian hyperstimulation syndrome. So this in this condition, the ovaries swell and produce an excessive number of eggs due to increase of follicle count. So coming to precaution in PCOS women, first is hydration and rest. A person should take care of the hydration. So hydration and lack of sleep can cause hormonal imbalance. So ensure plenty of water intake throughout the day, at least 7 to 8 hours of restful sleep. Stress should be managed, especially when the patient is going in fertility treatment, as the treatment can be emotionally draining and stress can disrupt the hormonal balance. Patient can be advised for yoga or meditation, which can decrease stress. Exercise is recommended to reduce weight and reduce BMI, which ultimately is effective in PCOS. There should be regular check of blood sugar levels for insulin resistance. The patient should be prepared for high and low, as it is a emotionally challenging, and the patient should have strong support system. So there is risk involved in PCOS, which is multiple pregnancy in ovulation induction or IVF. So also this, when there is multiple pregnancy, it can lead to preterm birth, gestational diabetes, and complications during delivery. PCOS may cause challenges on the road to parenthood, but advance in fertility treatment and careful approach, it is possible to overcome the obstacles by understanding the treatment option and adopting a healthy lifestyle. So these all ultimately they contribute to the success in PCOS. Thank you. Yes, PCOS is related to pigmentation in knee and neck areas, and as it causes insulin resistance. So there is something called as acanthus nigrans, which is often seen at the back of the neck. So it is related to PCOS. The treatment for this is again coming to lifestyle and then medications if lifestyle is not enough. Can PCOS make IUI less effective for me? No. If the right treatment and the right drug is given to the patient, then even patients with PCOS can give us a positive result with IUI. So, if you have any questions related to PCOS or any other infertility issues, you can contact our helpline. Thank you.